All right, so we're going to talk about partner assist during childbirth positions. We're going to start with hands and knees position, and then we're going to transition to sideline position and where the hands could go. So the first part here is we want to find the sits bones. So sits bones are here and here. So those are going to be useful to find, and then the other part is going to be kind of the iliac crest of the pelvis on either side here. That's where you're going to be putting hands as well. So during first stage of labor, you're going to be external rotation of the hips, so feet together, knees apart, and then your back is going to be arched upward, so opposite way, just like that. Good. And then to help as a partner, what we're going to be doing is putting your hands on your sits bones here. So way down in that gluteal crease, my hands are going to come together and just push inward. And what that does is that helps open up the top part of the pelvis during the first stage to help the baby dive into the pelvis more. And then when we get to the mid part, the transition, so then your legs are kind of in neutral, your back's sort of in neutral. And our goal is just kind of rocking here. We can rock side to side. We can also kind of rock this way, whatever feels most comfortable. Usually your partner's birthing can easily tell you which one feels better in general. And we're kind of inching the baby down the birth canal as we do these motions. Now if we go to second stage in this position, so now knees are together and feet are apart, and then you're letting your back relax down. Good. Now we're trying to open up the outlet of the pelvis. So our hands are way up here on the top. So we're not on the hips, which is here. We're way up here. And it feels kind of like that bony crest right up here. So we're going to pull together and just hold there. So sometimes it feels good for the partner to kind of lift up and kind of look upward or reach upward. So this would be great if you're kind of holding on to the top of the bed, kind of lift upward if needed. But yeah, hands on here. So we're going to transition to sideline. So in this particular position, we're doing the exact same things, just only with one leg. So if you're stage one, we're doing external rotation, so you're going to plant your foot, and then my goal here is just to support the leg either with my hand or using a peanut ball in this space, and then I'm still helping with the sits bone on just one side. So I'm finding that gluteal crease in the sits bone and I'm pushing down and in. So I'm going to bring this down so you can kind of see where my hand is. So my hand's going to be way down here. So and then you can still do kind of the arching of your back in this position and support here for the sits bones to open up the top space. In transition, if you're in sideline, then I'm coming here and I'm not pushing down, I'm just gliding side to side or forward and back in this position. And honestly, it's whatever's going to be most comfortable. So if the back needs to be arched by the birthing partner, that's perfectly fine. If the back needs to go the other way, whatever feels most comfortable in this position. Then if we go to stage two, so this is the pushing phase. Now I am supporting the ankle here. I'm going to get out of the way because the doctor or the midwife or whoever is going to want that space. So I'm supporting here. You can relax your leg. Good. And what we're going to do now is bring your back down. Good. And my hand is going to be up here in this iliac crest, or the top part of the pelvis, not the hip, but the pelvis itself, and I'm going to be pushing here. All right. And then this is a great position to arch your back if you need to, so you can bring your arms kind of up over the head, reaching upward, and my hands supporting here and here. So we're trying to open up the space in the outlet as much as possible. So those are partner assisted positions.